Hi, hello, welcome to Nursing Guru. Exams are nearer, right? In the last video, exam related video, I noticed that some of the comments regarding third year GNM OBG nursing repeated question paper discussion. So that is the reason today I'm going to talk about GNM third year OBG nursing question papers. In that question paper, we know that different type of questions are there, like fill in the blanks questions are there, defined questions are there, essays are there, short notes are there. So in that I choose one particular type of questions, that is filling the blanks type of question. So from that, within this minutes, I hope this video will be extended up to 5 to 7 minutes. Within this minutes, we will cover 50 fill in the blanks type of questions. Okay, so these questions are repeatedly asking questions. So if you are learning these questions and their answers, definitely you can score 5 marks in this year examination. So when is your exam? So exam timetable is out here. This year exam, if you are studying in Karnataka, your exam on 1st January 2026. I hope you are already started learning. So start learning with Nursing Guru. Let's move to the video. So first question, that is inability to remember this is the fill in the blanks type of questions. I will discuss above 50. So you should write, or otherwise now itself you should learn. Clear? So first question is inability to the newborn to initiate birth. Inability to the newborn to initiate the birth is known as birth asphyxia. Okay, so 3 different names are there. First is birth asphyxia, the same thing neonatal asphyxia or asphyxia neonatorum. If you are writing birth asphyxia or neonatal asphyxia neonatorum, you will get 1 mark. Okay, so what is that? Neonatal asphyxia or birth asphyxia means it is the condition where the newborn fails to initiate or start and maintain breathing immediately after birth. What is the reason? Maybe due to lack of oxygen. Okay, so this is known as birth asphyxia. So our first filling the blanks type of question, that is inability to the newborn to initiate birth, is known as birth asphyxia. Clear? Alright, the next question, that is second one. Excessive vomiting in early pregnancy is known as, we know that in pregnancy period vomiting is very common. So excessive vomiting, the name of excessive vomiting in early pregnancy is known as, the answer is hyperemesis gravidarum. Clear? Hyperemesis gravidarum. Excessive vomiting in the first initial state of pregnancy is known as hyperemesis gravidarum. Means a severe form of nausea and vomiting during early pregnancy that leads to dehydration. Means hyperemesis gravidarum means excessive vomiting. Okay, it is not like a normal vomiting, it is an excessive vomiting, so that may leads to dehydration and as well as electrolyte imbalance and body weight loss. Clear? So this is the second question. Remember, sometime this hyperemesis gravidarum asks for the 5 mark question. So if you have the idea, means you can write for 5 mark. Clear? So hyperemesis gravidarum means excessive vomiting in the early pregnancy, that is known as hyperemesis gravidarum. So we discussed 2 questions. First is inability to the newborn to initiate the birth asphyxia, excessive vomiting in the early pregnancy, that is known as hyperemesis gravidarum. Clear? Alright, the next question, that is the normal length of umbilical cord. Normal length of the umbilical cord. This is also a repeated question. Remember, answer is 50 to 60 centimeter. Normal length of an umbilical cord is 50 to 60 centimeter. Next question, the average duration of third stage of labor. We know that first stage, normal labor and the stages of labor, you will get a question, especially this is OBG nursing, so you will get a question like a essay or otherwise short note. Okay, so here some of the 1 mark question also we can expect from that region. The question is that the average duration of third stage, remember this is talking about the third stage of labor in primigravida mother is how many minutes? That is 5 to 15 minutes. Clear? 5 to 15 minutes. Remember. Alright, the next question is intermittent painless. Read this one. Intermittent painless uterine contraction is called. Okay. Intermittent painless uterine contraction is called Braxton-Hicks contraction. Clear? Braxton-Hicks contraction means that is the intermittent painless uterine contraction. Clear? I hope it is clear. We can move to the next question. Next question, this is the 1 word question or 1 mark question. That is the reason I am not explaining. For the essay question discussion or short note question discussion, we can explain more. Okay. The next question, that is pregnancy occurring outside the uterine cavity. Pregnancy normally where it is occurring? It is occurring inside the uterus. Clear? So sometimes this pregnancy occur outside the uterine cavity. That is called ectopic pregnancy. Clear? So what is ectopic pregnancy? Ectopic pregnancy is occurring pregnancy outside the uterine cavity is known as ectopic pregnancy. Most commonly it occurs in the fallopian tubes but also occurs in ovary, cervix and abdominal cavity. Remember. Clear? Okay, so here we are studied about intermittent painless uterine contraction. It is known as Braxton-Hicks contraction. Pregnancy outside the uterine cavity, it is known as ectopic pregnancy. Clear? Okay, so next question, that is first stool. It is very common and everyone it is familiar with this question. First is first stool of the baby. First stool of the baby. It is known as meconium. Okay, so meconium. So as a OBG student, you may be seen different patients who are admitted in the labor ward, postnatal area, intranatal area and in every labor related areas. Okay, so here you may be checked with the meconium of the babies. Clear? So what is the color of meconium? Okay, dark black or dark green color is it? So meconium, the first stool of the baby, that is known as the name. That is known as meconium. Clear? Next is craving for special. Usually in the pregnancy, the women may experience craving for some of the items. Is it? So craving for special food items during pregnancy, it is called as pica. It is not only about the food items. Sometimes they may be experience cravings for some items like clay or some other items. Okay, so their smell, they may be experience so much interest towards the smell. So that type of cravings, that is known as pica. Okay, it is a repeated question. Remember that one. Spelling is P-I-C-A. Clear? Okay, so move to the next question. The first is the bony canal. Bony canal through which the fetus passes through during birth is known as birth canal or pelvic canal. Okay, just to remember that the bony canal through which the fetus passes through during the birth is known as birth canal. Which canal? Bony canal, that is known as birth canal or pelvic canal. It is very easy to remember. Next, this question, it is a repeated question. Mostly this year you will get this question. The graphical record of cervical dilation against duration of labor. Dilation against duration of labor, it is known as partograph. Okay, this partograph you maybe get like a short note question or one word question. Okay, remember the name partograph. Next is the name given to lochia between 1 to 4 days is called as lochia rubra. So lochia rubra, what may be the color? It is a thick red color. Okay, so regarding question regarding lochia, we can expect this here. Next question, that is excessive liquor amni is called as excessive. Excessive means lot of. Excessive liquor amni. Amni means amniotic fluid. Excessive amniotic fluid is called as polyhydramnios. Okay. Excessive liquid amni, it is known as polyhydramnios. This is also a repeated question. Remember this one. Okay. Next question, the first fetal movement which is felt by the mother. Okay, the first fetal movement which is felt by the mother, it is known as quickening. Okay, the answer is quickening. Remember the spelling also. In the one word question, spelling also it is important. So when you are studying this one, remember the spelling. If you feel any difficulty to write the spellings, you should write in the paper 2 or 3 or 4 times. Okay, so that will help you to remember the spelling. So this is the one word question. For one word question, spelling it is important. Next is a normal length of the newborn baby. Normal length of the newborn baby, how many centimeter? Usually that is 50 centimeter, approximately 50 centimeter. If you are writing 40 to 50 or 40 to 60, you will get a mark. Okay. So next is normal weight of the placenta. Normal weight of the placenta, that is also, I think within this last 5 years, 2 times it is asked this question. The normal weight of the placenta is 400 to 600 gram, means a half kg weight. 400 to 600 grams. It is clear? Okay. So next question. So, and also one more thing you should remember, if you got the filling the blanks type of questions, you just write the question number and as well as the exact answer. No need to write the whole complete question. Clear? So here the question is, dash is the name given to endometrium. Dash the name given to endometrium during pregnancy. Endometrium, perimetrium, myometrium, maybe it is very familiar. Clear? So dash is the name. During the time of pregnancy, endometrium, it is known as decidua. Okay. During the time of pregnancy, endometrium, it is known as decidua. Clear? Clear? Okay, so next question, that is about first milk secreted from the mother is called as colostrum. Okay, first milk secreted from the mother is called colostrum. So it is very important, and we need to initiate breastfeeding immediately after delivery. So the first milk, it is very important for the baby. So all hospitals are recommended to initiate breastfeeding immediately after the delivery. So the first milk, that is known as colostrum. Clear? The next is dash is the graph representation to assess the process of labor. Okay, so the same question we are discussed before also. So anything regarding a graph or graphical representation related to labor, that is known as partograph. Okay, so remember about this name, partograph. Okay, partograph means or something, a graphical representation that assess the progress of the labor, known as partograph. Next question. A dark line running from the symphysis pubis to the umbilicus. Symphysis pubis to the umbilicus during pregnancy is known as. Usually this a dark line, most of the mothers during the antenatal assessment you can see that one. Okay, that line, it is known as linea nigra. Okay, clear? Linea nigra means it is a dark line running from symphysis pubis to umbilical during the pregnancy. It is called linea nigra. Clear? So we can move to the next slide. Here the first question. Cord attached at the edge of the placenta. Cord means umbilical cord is attached attach the edge of the placenta, it is known as batelot placenta. Clear? Okay. Next, the neuromuscular harmony between the upper and the lower pole throughout the pregnancy. Upper and lower pole of uterus throughout the pregnancy, that is known as polarity. Okay. You may have the confusion with the contraction or polarity. Some of the students, they may be writing contraction, okay, because it is a neuromuscular harmony between the upper and lower pole of the uterus throughout the labor. That may be contraction. Do you have any confusion regarding this contraction and polarity? So this is the right answer. Polarity is the right answer. Okay. Next question is, dash is the opening of atrial septum in the fetal circulation. Okay, again read the question. Dash is the opening of atrial septum in the fetal circulation. It is known as foramen ovale. It is known as foramen ovale. Next question, dash is the assessment of newborn well-being, that is APGAR score. So in the child health nursing also we are learning about APGAR score. So APGAR score maybe you will get for the child health nursing and as well as the OBG nursing. In OBG nursing, this is the one of the define fill in the blanks type of question. Dash is the assessment of newborn well-being. It is known as APGAR score. Okay. So last year also you may be studied detail about this APGAR score. Is it? Next is cerviprim is used for. What is the cerviprim? So cerviprim means it is a medicine. So cerviprim, that medicine used for what? What is the indication of cerviprim medicine? That is for the induction of labor. For the induction of labor, we are using the cerviprim tablets or medicine. Okay. So next about suture lies between two parietal bones in the newborn. We know that parietal bones. Listen. Different bones and sutures we are learned. So dash suture is lies between two parietal bone. It is known as sagittal suture. Remember, that is sagittal suture. Next question, dash is the discharge from the uterus following childbirth. It is known as lochia. The same question we are asked within 1 to 4 days. That is known as lochia rubra. Okay, so dash is the discharge from the uterus following childbirth. It is known as lochia. Clear? It is known as lochia. Hope it is clear. We can move to the next slide. So here, the process by which the reproductive organ return to the pre-gravid state, it is called. The process of normally after the childbirth, the uterus was enlarged during the pregnancy. So after the childbirth, the reproductive organ means the uterus return to the pre-gravid state. That is known as involution. It is known as the involution of the uterus. So remember the name, that is involution. Involution means the uterus returning to the pre-gravid state is called involution. Clear? Clear? Okay, so move to the next one. The normal length of a fallopian tube. Normal length of a fallopian tube, that is 10 to 12 centimeter. Okay, next question. The fusion of male and female gamete is called fertilization. So from the first chapter, anatomy and physiology chapter, we are learning about fertilization. What is fertilization? The fusion of male and female gamete is known as fertilization. Sometimes this is a very simple question, but sometime in the examination hall, when we are remembering about this one, we forget the terminology, we forget the term. So that is the reason I tell that don't neglect any of the simple question. You should give attention for every answer because you are the last year students. You need to pass this time for getting registration. So that's the reason this year it is very important. The third year it is very important. Only you have 2 exams. So carefully you should study. If you haven't started learning, start learning now with the Nursing Guru. Okay, next question. In breach presentation of denominator, it is known as, in the breach presentation, the denominator it is known as, the denominator is sacrum. Clear? The denominator in the breach presentation. Okay, in the breach presentation it is known as sacrum. Clear? Okay, next question is, the biparietal diameter measures about, answer, 9.5 centimeter. 9.5 centimeter. Next question, the process of formation of matured ovum. The process of formation of matured ovum in the ovary is known as oogenesis. Okay, what is the difference between oogenesis and spermatogenesis? Oogenesis, it is a formation of matured ovum in the ovary. Spermatogenesis means a formation of sperm. Next is the anterior frontal. The anterior frontal is otherwise known as bregma. Clear? Spelling is B-R-E-G-M-A. Bregma. Clear? Next is a woman who has never given birth to a viable child. It is known as nullipara. Okay, it is known as nullipara. Next, anterior frontal. When this anterior frontal is closed, this is also a repeated question. So remember this one. Anterior frontal is closed by 18 months of child. In the 18 months, anterior frontal will closed. Anterior frontal, it is otherwise known as what? Bregma. Anterior frontal or otherwise known as, it is bregma. It is closed in 18 months. Clear? Okay. So the next question, the denominator. The denominator in the face presentation is mentum. In the breech presentation, the denominator is cross. Which is the denominator in the breech presentation? That is sacrum, and the denominator in the face presentation is mentum. Okay, remember sacrum and mentum. Next is bimanual compression is used in shoulder dystocia. Shoulder dystocia. Bimanual compression is used. Bimanual compression is used in shoulder dystocia. Next question, that is fetal macrosomia is when birth weight exceed 4 kg. Means excessive weight. That is known as macrosomia. So it is considered as the baby with a 4 kg above weight. So the last question is, downy hair in the neonate is named as lanugo. Lanugo spelling is L-A-N-U-G-O. Okay, all right, is clear? So we have discussed a lot of fill in the blanks type of question. So from this, I am sure that you will get some of the questions. Okay, so that's the reason you should learn all this filling the blanks type of questions and as well as answers. So repeatedly watch this video or otherwise write it in a note. If you are writing in the notebook, means you can easily catch the topics, or otherwise 1 or 2 times repeatedly watch this video or take a screenshot and study well. Okay, so this is some of the filling the blanks question you can expect this year OBG nursing. Clear? So if you are a third year student or you have any third year students as your nursing friend, you should share this video with them. So for nursing or more exam related videos, follow us or subscribe our YouTube channel.